When we talk about healing, there's the traditional thinking and there's the modern thinking. Traditional means place the implant, wait, and check integration. But the modern thinking is place the implant, optimize the healing, monitor the healing, and then check. You'll have a greater chance of success. I think that's the obvious. How didn't they think about it before? So how can we optimize bone? Because bone is obviously what implants need. They need stable bone and the process called osseointegration. We need to understand bone. We need to understand how bone works. And we need to know that bone is a dynamic structure. It's not rock. It's not cement. It's a living structure that is influenced by a lot of things like gravity or lack of gravity, influenced by pressure, vitamins, even cholesterol, hormones, trauma, and also vibration. And I want to talk to you a little bit about the element of vibration because it's very poorly explored in our field. It's been a principle that NASA implemented in the 60s. This has been around for 60 years. Vibration influences bone in a positive way. So astronauts that are in space with no gravity, they're going to start developing early osteoporosis. I mean, and these astronauts are beasts. I mean, these are superhumans. But they're going to develop osteoporosis because of the lack of gravity. Hence, vibration plates were invented. And it's not a thing of the past. After I learned about vibration plates, I found one at home. I never knew we had one. And the idea is that when you vibrate bone in a certain frequency, you're going to improve healing. You're going to improve bone vascularity and healing and other benefits. And then I went into the rabbit hole of doing the research, and I'm not going to bore you with all the gazillion studies that are out there about vibration and bone, and specifically vibration and alveolar bone, which is the bone that we are fighting for every day, the bone that supports the teeth. That bone goes bye-bye when we extract teeth. So if there's a way to strengthen that bone, get better healing, vibration is a very good option to utilize. So what does high-frequency vibration do to bone? I'm just going to summarize it for you. It stimulates bone-forming cells, the osteoblasts, creating new bone. This is called osteogenesis. It reduces the osteoclastic activity, which are the cells that absorb bone, and it increases growth factors. So when I saw this was like music to my ears. To know that there's something pretty simple that we can use. And the vibration plate for the mouth is called Alveo 5. So I'm going to share with you, I have one here if you want to see. It's brand new, so no worries. It was in nobody's mouth. The Alveo 5 is a one-size-fits-all that the patient can use to create high-frequency vibration in the jaw. It does 5 things, and this is why it's called Alveo 5. It does the 5 things as follows. It creates and optimizes bone. That's the osteoblastic activity, reducing osteoclasts and fibroblasts, etc. It accelerates bone creation in bone grafts. It accelerates osseointegration, so there's some studies coming out on faster osseointegration, improves periodontal healing, recovery after periodontal surgery and general health, and some pain relief. There are other benefits that I'm discovering as I'm using it that are not claimed by this company. But the things that were scientifically proven are the biologic benefits, which I mentioned to you before. What I really love about healing is that we know more about how healing works, at least in today's world, using PRF, PDGF, other growth factors, GEM21, which is PDGF, using peptides, using different elements that can enhance healing is very well established. What we are lacking is how can we not buy products for thousands of dollars or charge the patient thousands of dollars for healing using something they already have in their body, built in, that we might be able to upregulate with vibration. So with high frequency vibration, we have two types of patients that we use in our practice where we use this technology. Surgical patients, patients that are about to have a procedure, and patients that are just interested in jaw wellness, that want to have better oral and masticatory system. So in surgery, the protocol is the following. A week before, the use is 5 times a day, 5 minutes each. If I had extra 25 minutes a day, I don't know what I would do. I don't know, an extraction maybe. But it's important for the healing. And after 1 week after the surgery, they keep the same protocol for about a week, and then continue at least twice a day for maintenance, because compliance is an issue with patients in general. I have one at home and I use it. Sometimes I forget. It's a drag. But if you get into using it, it becomes a habit, like anything. For jaw wellness, they don't have to use it 5 times a day, twice a day. And we use it for periodontal patients, patients with TMJ. Xerostomia is something that I found accidentally, because a lot of our patients losing teeth or losing a full mouth of teeth, they have rampant decay. And because of xerostomia, patients told me, you know what, it's squeezing more saliva out of my glands. Now, if they have an organic issue with their saliva, that is not producing anything, then it's not going to help. But if it needs some stimulation, it definitely helps with xerostomia. So here are my first cases. Gingival recession, and I've been using this for about a year now, close to a year. This patient needed a graft. I harvested the graft. I had a surgical error, and I created a graft perforation, which the periodontists in the room know exactly what it means. When you perforate your graft, you're hurting the vascularity. The thing might slough completely or partially. And things happen, even with care. Here's the graft sutured, and there's not a small perforation through and through. This patient was using vibration, healed beautifully. Within 2 weeks, couldn't be better. Is it the vibration? I don't know, but I threw anything I could at this case, and it definitely helped. Second case came in, patient came in crying. She's in ortho. I'm going to lose my teeth, and she will lose her teeth. Mobile teeth are not good candidates for ortho. Literally class 3. I didn't have the interview at the time. We're starting to see widening of the PDL. We're starting to see depressible mobility, which means we're starting to see almost like periapical lesions, although the teeth are vital. I recommended a graft. This time I didn't perforate. It was good. Great healing. We added high-frequency vibration to strengthen the bone. We added splinting. We use vibration as an adjunct to healing, to optimize healing. It's not one thing. What is the healing attributed to? Is it the patient's habit? Is it the instruction? Is it the antibiotics, the vitamins, their health, the sleep, vibration? We want to put in all the things that we think are going to help with the healing. And what's nice about this case, she's not going to lose her teeth. At least not on our shift, because the bone went back to normal and the teeth stabilized. She still wants to take the splint off and do veneers, but I vetoed it because I don't want her to lose her teeth. Third case was an early failure, also Aaron's your patient. Early failure, 4 weeks later, implant just came out. Bad healing. Used vibration only. That was the only difference. And got another implant in there with close to 90 ISQ. Okay? It stimulates the bone to heal faster, get a faster osseointegration, at least in the cases that I've seen. And I'm going to share a couple of cases from other doctors. There are a couple of doctors in the United States that are using vibration. We share our cases because we want to learn what other benefits might be in the process. This is from Dr. Bobby Horowitz from New York. I think he's in NYU. He's starting to take cores from implant sites. He's starting to see how soon vital bone gets created in the socket is pretty fast. Full vital bone in 7 months. He's starting to treat patients with peri-implantitis, doing the grafting, using the vibration to expedite the healing. I mean, these are old people. It's close to 90 years old. You don't heal that well at 88. But he's able to show on multiple cases how the bone comes back. On a young patient, you just look at them and they heal. They don't need to do anything, but all the patients, we know what happens there. So we're seeing a lot of promising results for a lot of the compromised patients. This is another case from Dr. Horowitz, where we're starting to see faster healing, more bone regeneration through the vibration process, and a couple of the publications that came out already show increased density around implants, where that was the only element, just through the vibration. So that's something we use in our office. Some patients report less pain, more anecdotal from my perspective, but some studies are starting to show that there's some TMJ pain that gets alleviated. Is it placebo? Is it distracting? Is it distracting from a different type of pain? But studies are coming in showing that this is very helpful. So I personally love the fact that it upregulates growth factors. Forget about a beautiful smile. Forget about aesthetics. It's the health of the body. If it can increase growth factors, you will get better healing. And I wanted to share this technology with you.